I also find for a lot of my ladies with Hashimoto's, it's a kind of a whole retraining of how they operate when it comes to taking care of others versus themselves. It's a whole journey of being a little more selfish, and not being so much of taking care of everybody else and themselves last. Do you find that as well?
Absolutely, and both personally and with my clients as well. And I know there are some like metaphysical origins. I always like to read all kinds of theories on what could be driving autoimmunity. And some people will say that autoimmunity is like a form of self-abandonment, right? That you put other people's needs and you're really disconnected with your inner knowledge and your inner knowing, and you end up doing things that drive yourself past the point, right?
Hello, my friends. We have a repeat guest back on the show because she's that amazing. We have Dr. Izabella Wentz back on, and she is the Thyroid Guru Gal. She's my friend. We love talking about all things health, pregnancy adventures, Hashimoto's things. We've had the joy of hanging out in real life, and she's just such an amazing woman, and I'm excited to have her back on. A little bit about my guest. She is an avid learner, a goal-oriented student. She received her PharmD, a doctor of pharmacy from Midwestern University Chicago College of Pharmacy at age 23. So she's a smart cookie. She's trained in functional medicine through the Institute for Functional Medicine, Kalish Functional Medicine, and the American Academy of Anti-Aging Medicine. She's a fellow of the American Society of Consultant Pharmacists and holds certifications in medication therapy management as well as advanced diabetes care through the American Pharmacists Association. And in 2013, she received the Excellence in Innovation Award from the Illinois Pharmacists Association. She has her own adventures in the thyroid world, which I will ask her personally about that. But she's so hardworking and so mission and goal oriented, and putting a lot of, I think, the pain of what she's experienced into her passion and mission with helping other people. She is an amazing author of a bunch of books: Hashimoto's Thyroiditis, the #1 New York Times bestselling book, Hashimoto's Protocol, her cookbook, Hashimoto's Food Pharmacology, and her latest book, Adrenal Transformation Protocol. And she has some really cool things on the horizon coming. So it's all a mouthful, and also creator of her own supplement line, Rootcology. So, girl, you are amazing. Thank you for coming on the show. Appreciate you coming back and sharing your time with us.
Thank you so much for having me, Dr. Lauren. And you are amazing. I'm always so inspired by you and how you show up and all the amazing things that you've done in your career. It's such a pleasure to get a chance to connect with you.
Oh, always, always. So I love when guests come on when what they focus on for their kind of area of expertise or their mission is something they've been through, because it's always so much more impactful. Like, it's night and day when you've gone through it yourself. And I can always tell that what you talk about with, your listeners and your readers is things that you have walked through personally. So why Hashimoto's? Give us a little bit about your story.
Yeah, I mean, to your point, I think it makes sense when you've done things and you've been on a journey. You're not going to ask people to do things that you wouldn't do when you have a lot more empathy. And for me, I became a Hashimoto's expert not because I thought it was particularly interesting during
Right.
pharmacy school. I was never really interested in thyroid disease and autoimmunity, or not even that interested in like lifestyle interventions or supplements, to be honest with you. But then I got this diagnosis of Hashimoto's in my 20s, a few years after I graduated from pharmacy school. And I realized how many of the challenges I was having, including chronic fatigue syndrome, irritable bowel syndrome, anxiety, panic attacks, so on and so forth, were all related to this autoimmune attack against my thyroid gland. And that conventional medicine, which I was trained in, right? Medication was the only answer. And it was utilizing thyroid hormones to replace your thyroid, its own ability to make hormones. Yet that only did like a fraction of help for all of the symptoms that I had been going through for a decade plus. And I became an expert in thyroid disease, autoimmunity, Hashimoto's, the root cause approach, because I wanted to get myself to feel better. And I
Mhm.
wanted to share that knowledge with other people once I figured it out to myself, because I just was like, why did I develop this condition? I was
Mhm.
relatively young for a woman to be diagnosed. Typically, women are diagnosed in their 40s or 50s around perimenopause. I was, in my 20s. And I was like, what is going on? Why am I having all of this? I thought I was living a healthy lifestyle, right? I was
Mhm.
getting, all of my vaccines. I was making sure I was eating whole wheat and low fat dairy and
Mhm.
exercising 5 days a week and so on and so forth. And yet I was still having a ton of symptoms and I was
Mhm.
feeling like my body was falling apart in my 20s.
Mhm. Yeah, I know, it's like the old school, food guide pyramid, right? 6 to 11 servings of grains. That'll keep you healthy.
Yeah, I think when you are interested in healthcare, like you try to follow the rules. So I was like, okay, I'm learning about things in pharmacy school and I'm like, okay, I'm being proactive about my health. I'm doing this, I'm doing that, and yet the outcomes were just like miserable. I was like sleeping 12 hours a night. I had carpal tunnel in both hands. I was waking up exhausted. I was basically fueled by caffeine. 6 to 8 cups of tea or like soda per day just to stay awake, and
Yeah.
acid reflux, irritable bowel syndrome. It was like my body was falling apart and I'm 40. I'm still 25, right? No. 15
Yes.
years, but I'm 25 still, right? I'm in my 40s now and I feel so much better than I did in my 20s. And
Mhm.
it's not, it's because I really learned about how to take care of my body. So I really hope to pass that on to other people.
For sure. I think we have a similar background when it comes to realizing that conventional medicine, we were just not getting the full story. I know I was a Kaiser patient in high school, and I just remember asking my doctor, what can I eat that's going to be better for my skin? And they said, there's no connection with your diet and your skin. And I just knew in that moment it wasn't true. And I was like, there's more that they're not telling me. And I'm going to go on this truth hunt. So it sounds like we're similar in that way that we want to research and know this for ourselves and pay it forward and teach people what we're learning, because there's so much that we just aren't told from our doctors. And sadly, it's not that different now in conventional medicine, especially when it does come to the thyroid. So, from what you've seen, I mean, what do you think are like the biggest misconceptions about Hashimoto's, like in the conventional medical world?
One of them is probably that the thyroid antibodies don't matter because you just need to essentially wait until the thyroid gland burns out and
Hmm.
then get on thyroid hormones. And I just think thyroid antibodies really matter. Everybody should be tested for them. The thyroid antibodies alone can be responsible for various symptoms. They can be responsible for trouble conceiving, miscarriage, anxiety, various mental health symptoms, cardiac issues, brain fog. Whole list of symptoms have been connected just to thyroid antibodies alone. And
Hmm.
the other thing is that they don't think thyroid antibodies can be reduced because
Right.
once you have them, you're going to have them forever. So they don't realize that there are ways to reduce them and oftentimes lower the aggressiveness of the autoimmune attack against the thyroid. And I feel like another big misconception is that all you need to do is take thyroid hormone when you have a thyroid condition. And a lot of times you'll have people who are dealing with so many of those symptoms of autoimmunity and they get sent to gastroenterologist for their IBS. They get sent to
Hmm.
a psychiatrist for their anxiety and depression. They get sent to, a pain specialist for the pain that they're experiencing. And then all of that is connected to the thyroid autoimmunity. And sometimes it's the consequences of having low thyroid hormone. Sometimes it's the consequences of autoimmunity. And sometimes it's like those root causes that are driving both of the autoimmune inflammation and some of these other inflammatory symptoms in the body. So
Yeah.
conventional medicine looks at us under like a little bit of a microscope. So it basically will say, Lauren, you have a head and you have a neck, but they're not connected, right? It's like what your neck does doesn't impact your head, and what your head does
Right.
doesn't impact your neck. And that's how it
Yeah.
feels like with thyroid disease because so many things impact our thyroid function and autoimmunity, including gut health, our stress response, right? And
Hmm.
foods that we eat. And conventional medicine is so disconnected from that.
Yeah, exactly. Like, how is your thyroid right here connected to your gut? It's totally different. It's so far, it's your joints, totally far away, but such a direct connection. And I mean, it kind of makes sense if you speak a different language with conventional medicine. It's like, okay, why would we monitor, antibodies if it doesn't change what we do? That doesn't like, why would they do that? And also, like, there really is nothing that can be offered until your thyroid is just totally damaged, and then we have to replace its function. So, But yeah, I agree with those. I mean, I love checking antibodies for patients, and it really does tend to correlate with other things, like maybe how much gluten they're having, maybe how much stress is in their life. Maybe they had a recent infection or something, and that's making their antibodies spike. So, looking at it from a bigger lens is really key, especially on how to individualize it for someone. Because you can have two women with the same exact elevated antibodies, and it's for two different reasons, right? So, being able to customize it for them
Yeah,
is
absolutely.
huge.
And they can even have completely different symptoms.
Right. Yeah, yeah, exactly. So maybe, for one, and that's why it's tricky with Hashimoto's because you don't always feel the same, right? So you may feel really tired on one day and the next day maybe you feel hyped and anxious. So can you talk a little bit of like so for people who are like, okay, what is Hashimoto's? It sounds like a Japanese person's name. But what is it? If, maybe they're only familiar with the thyroid, maybe being underactive. And we know that like if someone has a thyroid issue, chances are it's going to be an underactive thyroid, but like beyond that, what is Hashimoto's and what's the connection?
So, Hashimoto's is an autoimmune condition. And yes, it was discovered by a Japanese doctor, hence the exotic name, but it's very, very common condition. In fact, it's the most common autoimmune condition in the United States. About 20% of people, I would say 20% of women, probably have Hashimoto's. Most of them
Crazy.
are not diagnosed. They might
Mm.
be told that they have a slow thyroid, a sluggish thyroid, a low thyroid, that they are hypothyroid. Now, most people who have a sluggish hypothyroid, they actually don't realize, but their thyroid is probably working in overdrive, but it's also under attack by the immune system. And that's why it's not able to keep up with making enough thyroid hormones. And this is Hashimoto's. The research out there suggests that unless you've had your thyroid gland surgically removed or you were born without a thyroid, 90 to 97% of the time, it's actually Hashimoto's that's responsible for your hypothyroidism or low thyroid function.
Mhm. Yeah. Yeah, so understanding that underlying, physiology is key. So obviously it's more than just taking medication. So, let's talk about some of the root causes. Like what do you see are some of the main root causes that someone would get this condition?
The categories that I look for are going to be like food sensitivities. So, oftentimes, if you have celiac disease, this is probably the easiest example. There's
Mhm.
going to be a percentage of people with celiac disease where the gluten that they're eating is impacting and cross reacting with their thyroid physiology. And so the body reacting to gluten can mean that you're going to have an increased flare in thyroid antibodies and an attack on the thyroid gland. So that could be one particular food, but you actually don't have to have celiac disease to be gluten sensitive. To be gluten sensitive with Hashimoto's, a lot of people are going to react to gluten when they have Hashimoto's. Dairy is going to be another common food sensitivity. Then we're looking at the stress response. A lot of times people are going to have an impaired stress response. They might have blood sugar abnormalities, and this can be a
Mhm.
driver of the autoimmune inflammation. Sometimes, stress, people think of like, okay, you have a very high strung job or you're going through a messy relationship. These are very relevant, important causes of stress, but there's also past trauma that might have happened many, many moons ago. We can hardly remember that, but your body keeps the score and your body could still be reacting in that way. Stress can be from the actions we take. So, if we're sleep deprived, if we're eating inflammatory foods, if we're over exercising, this can be a driver of that stress. It can also be physiologic. So, you can have stress because of a toxin that you're exposed to. A lot of
Mhm.
times I see people have impaired ability to detox. There's a whole variety of different toxins out there that have been connected with thyroid dysfunction and autoimmunity. I think it boils down to essentially you have too much of the toxin and not enough of the detox capabilities. Chronic
Mhm.
infections are a really important, underappreciated root cause where sometimes people are like, oh, yeah, she's the thyroid pharmacist and she talks about food. And I'm like, there's this whole giant thing of chronic infections. H. pylori is one particular one that can be powerful
Mhm.
drivers of both an overactive and underactive thyroid and that autoimmune response against the thyroid. We also, nutrient deficiencies is another really, really important category. In some cases, people have been
Mhm.
able to get the Hashimoto's into remission by addressing selenium, myo-inositol, which used to be considered a vitamin, but it no longer is, as well as vitamin D levels and iron levels. I prefer the ferritin test. We can get into that a little bit longer. But
Mhm.
one of my theories is that sometimes thyroid autoimmunity may develop after a long-standing anemia.
Yes, absolutely. And I see also like Epstein-Barr or mold as well. And it's just kind of choose your own flavor, right? Like you could have two women again with the same or men too, but it's more common in women, but the same, elevated antibodies. And for one, it's Epstein-Barr related. Another one, it's H. pylori, maybe anemia related, right? Maybe they're not absorbing their iron. So getting to the root of it is so key.
Yeah, absolutely. And I think sometimes people will really rely on one thing, and I really encourage them to look into the different root causes. Some people, I've had people that are like very easy cases where
Hmm.
it was celiac disease and that was it. Or I've had people that was like, it was just a selenium and vitamin D deficiency and we needed a little bit of myo-inositol and like no more thyroid dysfunction. I've
Hmm.
had people who were like, oh, I just had this like stressful job and I quit my job and my thyroid function normalized. I didn't have to do anything that you said that I needed to do in your books, right? And then
Right.
other people where it is mold, Lyme, Epstein-Barr virus, and a multitude of like chronic gut infections where, we're really peeling back the layer of the onion.
Hmm.
Sometimes I've been writing my website, Thyroid Pharmacist, for over like 13 years, and I come out with a new blog post every week, and then I sometimes get feedback from people that they're like, "So, we have to take every supplement and we have to have like and we have every root cause?" And I'm like, "No, no, that's not how it works. There's like a whole bunch of root causes." For example, breast implant illness might be a cause for some women. That doesn't mean that everybody, has this. Most women don't even have breast implants, and some of the ones that do are not gonna have breast implant illness, but, there is just so many different causes, and I'm like, I kinda worry that people are gonna think they have every cause when I talk about them all, but also I wanna not be ignoring the causes. I don't know how you work with your patients on that too.
Yeah, I mean, I do thorough testing for everybody, but if I'm suspecting like maybe an infection root, we'll do some digging, maybe a like a viral panel, or we'll do a stool test. I haven't seen one single Hashimoto's patient with a totally normal stool test. There's always something that's off, So that's a big one. I'm so glad you brought up the breast implant illness topic because I had my implants removed a year ago, and, I've had thyroid issues that I've had to manage, since high school. My mom has them, my grandma, and I was able to cut way down on thyroid medicine after getting the implants removed. It was crazy, and I know that's not uncommon for women.
Yeah,
Yeah.
it's very interesting. I know anecdotally, I had spoken with a nurse who used to work for a plastic surgeon, and she talked about a large percentage of their patients developing new onset Hashimoto's after getting
Mm.
implants. And I just
Yeah,
thought that was
makes
so
sense.
fascinating, where,
Mhm.
really anything could be, there's so many different triggers out there where
Mhm.
sometimes your immune system is not happy for whatever reason, right? It could be the implants that it recognizes as a foreign invader, it could be an infection or even a food. And that is why it's important to do the detective work. I
Mhm.
gut tests are a really, really great place to start. If I had my way, it would be like everybody would get a gut test to look out
Yeah.
for that. I also love organic acids tests.
Mhm.
I
Yep.
didn't do as much with them when I wrote the book Hashimoto's Protocol. I just had started working with them, but I've had some clients that are doing everything seemingly correctly. They're eating all the right foods and they're taking supplements and so on and so forth. And they might have something like mold in their
Mhm.
homes, and that can be really suppressing their immune system, making their chronic they all of us have Epstein-Barr virus, right? Like, every single
Mhm.
person pretty much on earth has it, but
Mhm.
most of us keep it suppressed. But when you're mold exposed, you can actually reactivate some of these viruses, right? And so your body
Mhm.
cannot properly fight viruses, and so you can end up essentially having a active viral infection that could be
Yeah.
contributing to autoimmunity.
Yeah, I've seen that with patients for sure. Like they can see a direct correlation when they had to go up on thyroid medication and when they were living in a moldy house. And I remember back when I was going to medical school in Portland, I remember at the time I had to go up on thyroid medicine and I was living in a moldy townhouse at the time. And I didn't know a lot about mold, back then. And then again, when I moved into a house, many years later, same thing. So it's crazy just the direct correlation that I see with that. I love the gut topic you brought in. So let's bring that into it more. One of the things I talk about with my patients is just the importance of a healthy gut lining, and how leaky gut can be, connected with Hashimoto's and other autoimmune conditions. So can you touch on that?
Definitely. And I didn't mention that in one of my root causes, but this is a very, very common root cause, and there could be multiple drivers. Dr. Alessio Fasano came up with a three-legged theory of autoimmunity that I think a lot of functional medicine practitioners really have found incredibly helpful and relevant. And it essentially talks about how everybody might have the genetic predisposition for a condition, but the condition will not develop unless you have a trigger and then
Hmm.
an auto intestinal permeability or leaky gut. And that allows the immune system to get essentially confused. Now, we can really dig for triggers, right? That's something that we can definitely do and figure out if there are triggers in our lives. Some of the triggers we can absolutely change, some of them we really can't.
Yeah.
But so that's one pathway. We can't really change our genes to get ourselves into remission from Hashimoto's at this day and age. Maybe in the future
Hmm.
we might be able to, but we can always work on the health of the gut. And whenever we work on that gut health, we're going to see improvements in symptoms. We're going to see improvements in thyroid antibodies. Sometimes people might need lower doses of thyroid hormone. They can get into remission.
Hmm.
Um, going back to the Epstein-Barr virus example, Epstein-Barr virus can become reactivated when we are mold exposed. It can also become reactivated when we have certain gut infections, like protozoal gut infections, because they can prevent the immune system from properly managing that virus. And
Hmm.
whether it is a nutrient deficiency, whether it is some kind of an enzyme deficiency, or a chronic infection or a food intolerance, there is going to be something that we can identify that's driving that intestinal permeability. So I like to really dig deep on that with a lot of my clients, and when I educate my readers and people that come to my website or my podcast, I really focus on like, okay, what are we going to do with your gut?
Hmm. And IBS, this is a link that's emerging, right? You talk about the IBS connection?
It was really, really interesting for myself because I was diagnosed with irritable bowel syndrome when I was in pharmacy school. And then a few years later, my thyroid symptoms developed and I had acid reflux. And eventually I was diagnosed with Hashimoto's. And at first I was like, okay, is this connected? Is this not connected? And then of course, I came across the work of Alessio Fasano.
Mhm,
Basically, leaky gut is going to be asymptomatic in some cases. In other cases, it's going to present as IBS, right?
mhm,
I was like, oh my goodness, eureka. I have this, intestinal permeability. I've got symptoms of it, right? And when I started going to the Institute of Functional Medicine trainings, they talked about how irritable bowel syndrome oftentimes precedes autoimmunity by 5 to 10 years. So
mm,
get the IBS first, and then later you can get an autoimmune condition because of that leaky gut if you don't address the cause of IBS. Now,
mm,
the crazy thing for me is there's so many women walking around with IBS in their, teens and 20s and maybe early 30s. And they kind of, maybe don't think much of it. They're like, I just have a sensitive gut. I know I was like, oh, everybody's stomach hurts when they, eat food. Like that's just the normal part
yeah,
of digestion. And then they end up with an autoimmune condition down the road. And they don't realize that the two are connected. Now, because we understand the connection and with the autoimmune triad, we do know that that can be a really important thing to consider. I actually I've written 3 books about, Hashimoto's, 1 book about the adrenals, and my next book is actually on irritable bowel syndrome because I believe if we can take care of irritable bowel syndrome for the women in their men and women in their teens, 20s, and 30s, we can prevent the onset of autoimmunity. And I want to catch
wow.
people a little bit earlier before, a lot of the people that I work with that come to me, oftentimes they're in a very advanced autoimmune stage. Sometimes they have, they definitely need thyroid hormones because their thyroid gland has been under attack for so long and it's super damaged. And they definitely, many of them have multiple autoimmune conditions, right?
Hmm.
And kind of stop the progression and we can kind of arrest it. But if we address the IBS 10, 15 years prior, we could prevent all of those symptoms.
Oh
And so
yeah. So many other things, right? For them to be able to absorb nutrients and have strong bones and a strong brain and, immune system. I mean, aside from autoimmune, but just being able to fight infections and man, the gut health is where it's at, man. It's the center of our universe as our own body. We need that health. I think that's great. I think that's really important to focus on that so that they don't get to that place where they end up having Hashimoto's. There are amazing things that could be done if that is the case, but if you can catch it ahead of time, I mean, really set yourself up for a much healthier path down the line for sure. So let's say somebody is suspecting that they may have Hashimoto's. Maybe, there people can run their own labs now. I don't think a lot of people know that. So if your doctor isn't running labs for you, I mean, there are different companies you can run your own lab work. I don't recommend to treat yourself necessarily, but if you're not getting the labs that you need, plug in my computer. Um, but typically when you go to your doctor, they're running just the basic TSH, maybe T4, right? So what are the other things that they should be asking for that are really important to get a full workup?
a TSH is very helpful for very advanced thyroid disease, but in most cases, it's going to be super late to the party. So, in
Yeah.
order to find thyroid disease early when it first sets on, I would recommend doing thyroid antibodies,
Mhm.
TPO antibodies, and TG antibodies. Free T3, free T4. This tells us what thyroid hormones are present and what levels they're present in the body versus, TSH just tells us how the pituitary is responding to thyroid hormone levels, and there could be a disconnect. And then I also like to recommend for people who are like just on their diagnostic journey, trying to figure out what the heck is going on, reverse T3 in many cases,
Mhm.
because sometimes you can have every thyroid symptom in the book almost, but it's actually not thyroid driven. It could be driven by something else that forces your body to make more reverse T3, which is essentially a thyroid hormone, but it has more of a blocking activity
Mhm.
on receptors so that your active thyroid hormone doesn't get in and then
Mhm.
all those symptoms. So that's like a really, I would say, minimal thing to get. And I love working with Ulta Labs
Mhm. Yeah,
because they
same.
allow they allow people to self-test, and then in some cases, not in every case, but you can also I don't know how they've worked out this voodoo, but you could turn in your receipt and get reimbursed on insurance, where I don't think the other
Wow.
lab companies out there have that, but I've had a lot of my readers and clients do that successfully. Of course, I'm like, "Check with your insurance first. Don't believe me, like, check with them, make sure that they'll take this."
Yeah, I love that. I mean, I think if not everybody can afford to see a naturopathic doctor, let's just be real. So if you're seeing your doctor and they're refusing to run certain labs, then you can run those labs and bring them in like, hey, check it out. They can't argue with the data. But you have to realize that you may speak a different language than your doctor, and your doctor may say, "Oh yeah, your antibodies are high," but so what? They may not really address it the way that, it needs to be addressed. So you do have to be able to kind of speak the same language. But yeah, there's no reason to be in the dark about what your thyroid is doing. You can always get the data. So, well, let's dive into giving some people, some hope and maybe like if let's say someone's dealing with this and they're like, all right, I do deal with Hashimoto's. I think I'm really struggling here. Like, what are maybe some basic things that they can start with that's just going to help no matter what the root issue is for them? Like just some supportive kind of tangible basics that they can start with. And then maybe we can get into some of the other things that we see that really can help more kind of specific cases, I guess.
Definitely. So definitely focusing on blood sugar balance. And I would say for most people, this looks like more protein and fat than the standard American diet and less um, processed carbs. Blood sugar swings can really increase that autoimmune attack against the thyroid gland, and they can be responsible for symptoms like the weight gain,
Mhm.
anxiety, fatigue, night wakings when you want to be sleeping. And so then your body's not properly regenerating. This is something most people can do, and I think they could do it safely without the advice of a physician. Of course, it always helps to have practitioner that you're working with. The other thing is to consider doing an elimination diet.
Mhm.
Some of the most common foods that trigger thyroid disease and thyroid symptoms would include gluten, dairy, and soy. And I
Mhm.
would generally recommend there's more foods than that, but I would say percentage wise, those are going to be like 80 to 90% of the time
Yeah.
react for people with Hashimoto's. Some of the other ones might be like 10% of people or 15% of people. So
Mhm.
why not try to do an elimination diet for 3 weeks of those three foods and see if you feel better? I've had people who felt better in 3 days, 5 days,
Mhm.
where they're like, oh my gosh, my symptoms are so much better. Like my brain's working so much better. I have clarity now.
Yeah.
Um, Again, this is something people can do at home. The other
Mhm.
things that I oftentimes recommend would be, kind of basic, but making sure you're getting plenty of rest, that you're
Yeah.
focusing on doing things that bring you joy, that bring you energy versus focusing on things that drain you. I have my clients usually take a piece of paper and to put a line down the middle and then what makes me feel better, what makes me feel worse. And we write out like what makes you feel better. Generally, for people with hypothyroidism, being in cold environments is going to make them feel worse.
Mhm.
So, cold plunge is probably not a good place to start. Uh,
Yes.
that make you feel better would be getting a warm bath, right? Or making sure you're keeping yourself warm. When you have an underactive thyroid, your body's already struggling to produce thyroid hormones. And so you could take a replacement to give you the hormones you need, but that's kind of dosed on like average temperature. And if you're going to be going through a lot of cold exposure, you might just be very hypothyroid and that might put you out. Even I will see oftentimes on a tangent, but people who are on thyroid hormone replacement, oftentimes they need more in the winter than they do
Mhm.
in the summertime just to keep up um, with their demands that we need for generating heat in our bodies. So
Yeah.
these are really easy things most people can do. I would say I feel pretty comfortable recommending a lot of supplements like magnesium, generally
Mhm.
safe and well tolerated for most people. Myo-inositol and selenium is going
Mhm.
to be generally safe and well tolerated by most people as well. And that's something that a lot of people will find that they introduce, and that's going to be very supportive of their thyroid function and symptoms.
Yeah, I would echo all of those things, absolutely. And I find for a lot of these ladies too, because the thyroid impacts your metabolism so much. Sometimes there's this feeling like I have to work out a lot, otherwise I'm going to gain a ton of weight. But doing a lot of that intense exercise can really work against you. So finding, asking yourself, like, how do I feel after a hard workout? Do I crash and burn? Well, probably it's not the best thing for me right now. So definitely getting in some movement, but if you're not walking, bringing in some walking and just allowing that nervous system, that limbic system just to relax. And I also find for a lot of my ladies with Hashimoto's, it's a kind of a whole retraining of how they operate when it comes to taking care of others versus themselves. It's a whole journey of being a little more selfish, and not being so much of taking care of everybody else and themselves last. Do you find that as well?
Yeah, absolutely. And both personally and with my clients as well. And I know there are some like metaphysical origins. I always like to read all kinds of theories on what could be driving autoimmunity. And some people will say that autoimmunity is like a form of self-abandonment, right? That you put other people's needs and you're really disconnected with your inner knowledge and your inner knowing, and you end up doing things that drive yourself past the point, right? So
Mhm.
you are somebody that is over caring for others, or you're pushing yourself to over exercise because you think it's good for you, or overwork, and so on and so forth. And a part of you getting into that healing state is putting yourself as a really, like I recommend treat yourself like you would a small child or a pet that you
Right.
really love, right? And give yourself that same love and care and
Mhm.
grace. Sometimes I find that women with autoimmunity and Hashimoto's are very hard on themselves,
Mhm.
where there's this message in their brains that's constantly criticizing them and you did this wrong, you messed up, why are you so lazy? Why are you so this? Why are you so that? And kind of thinking of the mind and body connection. Autoimmunity, when you think about what's happening, it's the immune system attacking self. When you're highly self-critical of yourself, right? That's your brain attacking you, right? That's your mind attacking you. And I feel like there's a really big connection there. And so a big part of
Mhm.
what I do with women is we work on rewiring that thought process and how do you treat yourself with kindness. It's something that most of us don't realize is going on in
Mhm.
our subconscious, but it's constantly there. And then you can really, we think about the body and the different states it has. When we can shift the body into a parasympathetic state, that activates our natural healing within.
Mhm. Wow. Yeah, and changing the way that you think and the way that you talk to yourself, the immune system listens and it changes
Yeah.
also. Wow. Oh my gosh, I love this. I could talk about this all day. Let's see. Is there any particular success stories that you can share that, you know, stands out in your memory? I'm sure there's so many from all the people you've helped.
A few different success stories. So one of them that I really love to share is somebody that had multiple chemical sensitivities and she couldn't walk past a Yankee Candle store, for example, and we focused on liver support. And then all of a sudden, she was able to get rid of her multiple chemical sensitivities. I have women who have had like histamine and oxalate issues, and then
Mhm.
we figure out how to get that. We look at what's driving those in the gut, for example, histamine producing protozoa and H. pylori, and getting them on P5P, the active version of B6, can help to break down some of those histamines and they no longer have histamine issues. Or for
Mhm.
oxalates, we would look, I had women with interstitial cystitis and joint pain, a lot of thyroid antibodies, and sometimes it's a candida and oxalate colonization. And we get rid of that. And all of a sudden, they are um, they're no longer in pain and they're no longer have bladder issues. They're no longer having that frequent urination. And,
Mhm.
that's something that we can easily solve. I don't want to say
Yeah.
easily, but I'm excited because I see people sometimes that have decades of symptoms and sometimes we can tweak a few things here and there. Uh,
Mhm.
a lot of, I've had people who had really bad irritable bowel syndrome and the early onset of Hashimoto's, and we've been able to figure out that they had some kind of a protozoal infection, and we can treat that, and then um, the Hashimoto's doesn't progress, and their IBS goes away, right? Uh,
Mhm.
let's see what fun and
Amazing.
exciting things. Sometimes it's like really easy cases that I love to share because it's like, oh, I treated a sinus infection and it turns out my sinuses were dripping into, causing inflammation around my thyroid and whatnot. And then that treatment goes away, or sometimes it's an H. pylori infection. But for many people, I will say sometimes it's peeling back the layer of the onion, at least the people that
Right. Yeah. Yeah, exactly. It's not always easy, but it can be a simple fix when you figure out what the root is, right? The root
yeah.
cause.
If you figure out exactly kind of what's driving it.
Mhm.
Another a big kind of a really simple thing that has helped a lot of people is actually high dose thiamine, benfotiamine,
Mhm.
and it's specific to thyroid fatigue, where I have had people with like years and years of thyroid fatigue, and it's benfotiamine 600 milligrams within 3 to 5 days. People just can wake up from that fatigue. So I've had people who were
Wow.
on disability being able to work, people who were bedridden being able to ride horses. It's just
Wow.
been phenomenal. And sometimes it's like one easy thing that can get you over that hump. Of course, there might be a few more things we might need to do, but sometimes it's like you make one change and a symptom vanishes. And I love seeing that.
Did you mention too, I think in another conversation we had, methylene blue? Was that something that you've seen beneficial changes with?
I really like methylene blue for brain fog. So
Mhm.
women that struggle with focus and brain fog can find methylene blue. Anybody really, doesn't have to be women, but that can
Mhm.
be really helpful. And I also love carnitine. So I use a
Mhm. Oh, yeah.
combination of L-carnitine with acetyl L-carnitine. And sometimes I have had women who have had brain fog for many years, and that lifts. I believe part of it is mitochondrial support, part of it is ammonia is this toxic byproduct of various gut infections. If you have low stomach acid, which many people with Hashimoto's do, if you have constipation, which many people with Hashimoto's do, H. pylori also can produce ammonia. You can actually have
Mhm.
toxic levels of ammonia that's produced within your gut, and carnitine can actually clear the ammonia out of your system. And
Mm.
muscle weakness and brain fog are some of the symptoms of elevated ammonia. So it's been
Right.
really amazing to see sometimes we can use various tools to get rid of symptoms.
Absolutely. Yeah, I remember you talking like early in your Hashimoto's journey how bringing in some HCl support was like a game changer, right? Just to get that stomach acid working better and just right there. I mean, you're absorbing nutrients better. You're preventing a stronger immune system and all of that. And yeah, the L-carnitine makes sense because you need that to also just burn fat for fuel. So if you don't have enough L-carnitine, it's like you have this money on the table. You're not using because you can't access it, and that L-carnitine is so key for that. So I love all of that, and and these levels can be tested too. So um, may not be great for people listening just to try all these things, but they are great tools to consider. And micronutrient testing can show like what are your B1 levels, like what's your L-carnitine level look like. So then that can be a little more targeted. Um, Awesome. Well, I want to just bring in maybe a couple quick questions from people online. One question from Kimberly, she was wondering, is it possible to switch from hypo to hyperthyroid? I can say for me, it's not super common, but it is something that can happen in my experience with patients, especially with autoimmune thyroid conditions with Hashimoto. So if there's a flare, sometimes we can see where there's hormone dumping that can happen, where you might feel wired, anxious, heart palpitations, kind of have that hyper phase, but then oftentimes it swings back into a hypo phase. And some people have both Hashimoto's and Graves. So would that be your answer too? Is there anything more on that you'd say?
Yeah, that would definitely be my answer. And of course, we don't want to overlook over medication. Sometimes when we use too much thyroid hormone, then the person can become hyperthyroid. And
Mhm.
especially if we're doing lifestyle interventions too. So sometimes people will start on selenium and myo-inositol and they don't need as much thyroid hormone. And then they can become hyperthyroid. And then that's an indication that you need to reduce the dosage of thyroid hormone. And I mean, that
Right.
can be a good thing sometimes. You don't need as much thyroid
Yeah.
hormone, right?
Exactly. But you gotta be testing it, monitoring your symptoms, checking your levels. One question was how Hashimoto's and hypothyroidism are how it affects pregnancy. And I will say, for me, I'm entering my third trimester now. When I first found out I was pregnant, I had to up my thyroid medication by a lot because my body's like, okay, I need a lot more. But after I have this baby, I'll probably need to go down on the dose. So it does affect levels quite a bit in pregnancy. What would you say to
Yeah.
that?
Yeah, such a good point. So something to consider is one is that Hashimoto's antibodies and not having enough thyroid hormone on board can increase your chances of having trouble to conceive, can
Mhm.
increase your chances of miscarriage. So
Mhm.
if you have a family history, I mean, I would just recommend for everybody to test their thyroid antibodies and their thyroid function before they get pregnant, when they're
Mhm.
trying to get pregnant. And I'm a big proponent, some women that I work with or talk to, they're like, I want to try things more naturally. I want to try like myo-inositol selenium or red light therapy or, whatever other low dose iodine therapy or iodine restriction therapy, I should say, to
Mhm.
get their thyroid function normalized. And I'm supportive of that in cases where it makes sense. Like if you have had your thyroid gland removed, I'm not going to be supportive of red light therapy, right? Like that's not going to help. Like it's not going to grow back your
Mhm.
thyroid. And also, if you're trying to conceive and pregnant, your best outcomes are going to be to make sure that you are on proper thyroid hormone and that you are monitoring that. As soon as you get pregnant, you might need an increase of dosage. Around
Right.
20% or so is what typically is recommended, but your needs might vary, right? And so
Yeah.
making sure you're monitoring your levels every 4 weeks or so throughout your pregnancy. A lot of
Mhm.
times women with Hashimoto's also have low ferritin levels, so you do wanna
Mhm.
make sure that you're testing your ferritin levels. This can be an important cause of um, red flag for iron deficiency anemia, and this can make your thyroid and pregnancy symptoms much worse. A lot of times women might have issues with progesterone. So you might have to be somebody that gets on a progesterone therapy in your first trimester. This is
Hmm.
more common in women with hypothyroidism to prevent miscarriage. Generally, for older women too, you might have issues with premature ovarian insufficiency. This has been tied to both Hashimoto's and to Graves' I'm sorry, this has been tied both to Hashimoto's and Addison's disease.
Hmm.
And there are different things we can utilize for that, including utilizing DHEA
Hmm.
before trying to conceive to support um, ovarian function. Coenzyme Q10 can work. Um, we can also utilize ovarian PRP or stem cells, which are a little bit more innovative to help rejuvenate the ovaries and help with that egg quality. So these are some of the ways. And then we do want to make sure that we are properly monitored for postpartum thyroid issues. We do
Hmm.
know that postpartum thyroiditis is something that can happen in people who don't have a history of thyroid disease, but they might have thyroid dysfunction right after giving birth. Or some women might have worsening of thyroid function after giving birth. Some women's thyroid function might improve, but it's an important cause of um, having trouble with breast milk production. It's an important cause of depression and fatigue, even postpartum psychosis, right? Postpartum depression. These can be related to thyroid dysfunction. So, this is something that I would say if you have a thyroid condition, you need to make sure that you're monitored more before you
Hmm.
get pregnant, during
Hmm.
pregnancy, and in the postpartum area. It's still possible to get pregnant and have absolutely healthy, beautiful children, but you do want to be more mindful of the proper monitoring.
Hmm. Oh yeah. So helpful. Agree with all that. I personally had postpartum and low milk production after having my son 6 years ago. So I can look back and see I needed to monitor my thyroid a little better. So that's something I'm definitely going to do different on this go around because I'm 44. So hormones, we could do a whole nother episode on the hormone interplay with thyroid, but we have run out of time because this has been juicy. Is there anything else that you want to leave with our listeners? Any, final thoughts, parting words?
Thank you so much for having hold on a sec. Thank you so much for having me, Dr. Lauren. I feel like for anybody listening, if they are struggling with Hashimoto's and if they've been told that all they need to do is thyroid hormone and all of their symptoms are in their head, I do encourage them to dig deeper and educate themselves because oftentimes there are pretty straightforward interventions that can help you feel significantly better. And there are always things we could look for that are a little bit deeper if you're still having symptoms.
Yeah, how you feel is valid. And just because a doctor runs a lab and it's not out of range, it doesn't mean that what you're saying isn't valid about what you're dealing with. So I hope everyone here feels validated. So for people who want to continue to follow what you're up to, how can they do that?
I would love for them to find me on social media. So I'm on Facebook, Instagram, TikTok, and YouTube. You can find me under Thyroid Pharmacist Dr. Izabella Wentz. I have a podcast where I interviewed Dr. Lauren recently, and it's Thyroid Pharmacist Healing Conversations. So I hope that you'll come and visit there and listen. I share ways to get Hashimoto's into remission and all the different root causes, as well as about other kind of conditions, like proper ways to heal them beyond conventional medicine. And I also have a book. I also have books that you can pick up on Amazon, including my book Hashimoto's Protocol, which is a 90-day plan to help you feel better with when you have a thyroid condition and get it into remission, hopefully.
And I have recommended it to so many patients. So if you read this book, you'll know more than 99% of doctors. I can assure you that. Thank you so much for the work you're doing. Thanks for coming back on the show. And we appreciate everything you're doing. Come
Thank you
back
so
and see us
much.
soon.